And now for the session you've all been waiting for, digital health, clinical entrepreneurship and innovation. Today we're joined by two inspirational entrepreneurs, both clinicians by background, who've found problems and really gone all the way to solve them and improve healthcare for the better. First up, we have Dr. Sandeep Bansal, founder of Medic Bleep and CareBite in India. And following Sandeep, we'll have Tamsin, Holland, a paediatrician based in Cambridgeshire, who's been leading the way against supporting hearing loss in children and is also part of the NHS Clinical Entrepreneur Programme. So, Sandeep, how's it going?
Yeah, good. Thank you, Rajiv. Thanks for having me.
It's great to have you here. And just to give you a bit of a brief around what we've been discussing today, we've had some really stimulating conversations this morning around digital health and innovation, particularly across UK and India on the roundtable. And I know that you've achieved a tremendous amount. So I was wondering if you'd be able to give us a bit more of an insight into yourself and the work you've been doing. Over to you.
Yeah, absolutely. Thanks, Rajiv. And thank you all for joining the session on a Saturday and giving up your Saturday afternoons in India and Saturday mornings in the UK. So I've got a slightly different, unique perspective, I guess, just because of my journey. So what I'll do is go through a little bit of my journey, talk to you about my journey into entrepreneurship and the challenges that I see in the world of healthcare going forward for future generations. So how I'm slightly different is I'm born and brought up in the UK, but I actually ended up going to India to do my medical degree. So I graduated in Manipal, so in the southern region. Usually it happens the other way around, where students come across from India to UK medical schools. However, I didn't actually get into the medical school that I wanted, which was Cambridge. And I guess that was my very first understanding of what it is like to be an entrepreneur, because failure is just so common. I graduated from Manipal, and then after Manipal, because that was a private medical school and private medical system, I kind of wanted to understand what's it like to work in a government hospital, government system in India, and compare it a bit more to the NHS, comparing it like for like and apples to apples, I guess. So I went and worked in a government hospital, a very busy hospital in Delhi called Hindu Hospital. That was a really eye-opening experience for me. As a junior doctor in the NHS, on a given day, my patient list would be 8 to maybe 15, 16 strong. But in the government hospital, usually I was looking after a 60-bed ward, but typically there were over 80 to 100 patients on those beds, doubling up. And it made me appreciate the NHS a whole lot more and what we have in the UK, for sure. I came back across into the UK at that point and worked 5 years clinically. In that time, I took a gap year to do a master's in paediatrics from Imperial as well. I also, my family background is that we run nursing homes. So nursing homes, just for those from India here, nursing homes in the UK are very different to those in India. They're social care settings, they're for the elderly. So old age homes basically is probably what you know them as. And I scaled that business from 200 beds to 420 beds and grew it to about £15 million in revenue. Now, at that point in life, from my naive eyes, I thought that social care system was very connected to the NHS. However, having gone through that process, I realized it's far from the truth. 2012, I came back into the NHS and was doing GP training in Oxford, when I realized that actually technologies are going to be a key enabler to moving healthcare systems forward for the future generations and to make sure that their NHS is sustainable. One of the key challenges that I saw was around communication, all the way through social care, right the way to primary, secondary care, inter-team communication, which is very fragmented. You'd often get patients coming to hospital or being in an ambulance and having to repeat their stories time and time again. And you know, if you're a patient and you're suffering, that's the last thing that you really want to be doing, you know. And I thought that us clinicians, we should have the right tools to actually not let that happen from the patient perspective and journey. And I did a survey of 2,000 doctors, and 75% in 2014 December admitted to using WhatsApp to share patient data. Now, of course, that's not really compliant with healthcare regulations here in the UK. And I know these sort of regulations are also coming out in India now as well. But that wasn't the problem. The problem is that actually clearly the older ways of communication were not optimal for patient care, for delivering patient care. So that's when I started out on my journey of creating a instant messaging solution, basically called Medic Bleep, which is much like WhatsApp, but for inter-team communication, and the conversations around patients go directly into the patient record. What we showed is that we save each nurse 21 minutes per shift and 48 minutes per shift for every doctor. Now, if you extrapolate that out across the NHS, that's the equivalent time saving for 11,000 nurses. Now, I don't know how aware you are, but we're 40,000 nurses short at the moment in the NHS. So just giving such simple tools and solutions could save up to 25% of the workforce's, the gap in the workforce time. However, it's not as simple as that. You know, implementing change in the system has been a hard journey. And you know, along the entrepreneurial journey, I've realised some of the bureaucratic hurdles that exist in the NHS, some of the challenges with regards to change management, and just getting frontline time. You know, so if the NHS is 95% capacity, especially during COVID, that literally means that every hour and 15 minutes after a patient is discharged, that bed is being filled again. Now, where in this journey does a doctor or a nurse actually have time to engage with change? You know, they're just fighting fires. So these are some of the big challenges that we need to try to work upon as a system. With Medic Bleep, we partnered with British Telecom and Apple and Samsung to remove those pages. But during the pandemic, I think it became really apparent to the global sort of, to the whole globe and to all the world and individuals, that what we need to do is actually move a paradigm shift in healthcare. It's not just about fighting the fires, it's actually about preventing disease rather than trying to put ourselves in a position where we need to cure, you know? So just some statistics which really stick out to me. 2 in 7 of us live with non-communicable disease at any time. Now, most of these are preventable. You know, a lot of you are clinicians on this call, so we can prevent them from lifestyle, nutrition, and good habits. India's instance of diabetes is occurring 10 years prior to that of the Western world, at an average age of 45 compared to 55 in Western nations. The economic impact of these non-communicable diseases in India is estimated to be $4.6 trillion between 2012 and 2030. Now, let me put that into context. You're all aware of the 21-day lockdown that happened in India at the latter part of last year, I think. Now, this is equivalent to 2 national 21-day lockdowns in India every single year from an economic perspective. I also read a stat from the WHO in which 55 million people in India go into poverty every single year due to not being able to pay for their healthcare bills. I was astounded, you know, because obviously in the NHS, we're very fortunate in that we don't need to worry about our healthcare bills and paying for healthcare, unless, of course, we want to and we want to get private care. But at point of care, if there's an emergency, we don't need to worry. That got me thinking a little bit deeper about insurance in India. And only 15% of India, other than those covered by Ayushman Bharat, are actually insured or have any sort of health insurance, which means 90% of India's healthcare spend is out of pocket. Now, workforce challenges also exist, and they exist globally. 3.3 million healthcare workers shortage is going to happen in India by 2030, unless we look to move healthcare and the way we deliver it, again, in paradigms. There's an over-diagnostic and over-prescribing challenge that exists. There's a study done in Madhya Pradesh which showed that 10% of all drugs prescribed and diagnostics done were overprescribed and overdone. Now, that statistic goes up to 50% when you're looking at those individuals over 65. So with all of these sort of challenges, I thought about starting CareBite, which is about to go live in Delhi and Gurgaon region in the next 20 days, focused on preventative healthcare and primary care. Another problem that I saw in India is, as a junior doctor, I could have been a GP immediately after graduating in India, whereas in the UK or in the US or Australia, any developed nation, I had to train for another 5 years to become a GP. So we're trying to bring that level of robustness and working with the MRCGP and other sort of organizations to bring that level of robustness into India. Now, it's about how can you incentivize people and shift care downstream so that they actually look after their own healthcare when it comes to it. That's the holy grail, right? They shouldn't really be needing to come to a doctor in the first place, because if that's the case, then surely at some systemic level we fail them. That's how I see it. And so CareBite, what we're trying to do is incentivize them by giving rewards. So if they're sticking to their healthcare habits and achieving their own goals for their own health, which could be very individual, of course, they get rewards, which then they can redeem at retail stores like Amazon or Big Bazaar or Nike or Starbucks or wherever they so please. So we're trying to gamify and give them some of that instant gratification, which we're so used to. Of course, healthcare and changing health takes a lot longer, so you don't see those instant gratifications. So we're trying to build in a gamification model which can help with that. But these challenges exist globally. These aren't just unique to India. Of course, the NHS is trying to do a lot more when it comes to public health as well. But these are some of the challenges that I've seen as a doctor, as a patient, as someone who's run services before, and these are some of the challenges that I'm trying to tackle when it comes to India. Thank you. Rajiv, over to you, I guess.
Thanks, Sandeep. It was a really powerful 10 to 15 minutes there. I know lots of people have expressed interest to hear more about the work you're doing. I know that you're short on time today. I was just wondering, how you'd recommend people get in touch with you. Are you happy for us to share your details or connect with you on social media?
Yeah, absolutely. My Twitter accounts or my email address. Happy for that to be shared, Rajiv. And I don't know if there's any questions right now that I can help tackle, but yeah, happy for people to get in touch.
Yeah, the team have selected one question, and that is, what's your top tip for a clinician who, has an idea, wants to make it happen? What would you say? What are the starting steps for them almost?
Yeah, so I think the key starting step is you as an individual will need a team around you, right? So it's all about the team. And without a team, without the right people who believe in what you're trying to achieve and the problem that you're trying to solve, it can't be solved. I've got a great team that I formulated over the last year trying to tackle this problem in India. And it's taken me a year to put together a team of 15 people, right, who believe in the same vision. So take that time out to find the right people who believe in the vision, who are the right people to actually tackle that problem with you.
Yeah, great. Couldn't agree more. And thanks so much for your time this morning. We're really looking forward to all the amazing stuff and the creativity that you're bringing to all the projects that you're involved with to improve healthcare. Thanks again, Sandeep.
Thanks, Rajiv. Thank you. Thanks. Have a good day. Bye.
So now, next up, we have Dr. Tamsin Holland Brown. And Tamsin has joined us with a few hats, and one of those hats is as part of the leadership team with the NHS Clinical Entrepreneur Programme, which she'll be sharing more about the programme with us when she comes on. She's also an innovator and has been leading some really, really impactful work to support children. So, without further ado, Tamsin, can you hear me? I think we're just getting things ready, Tamsin's got some very helpful slides to share.
Yeah, I can. I'll try and share them myself. It was just thank you so much for inviting me along today. Delighted to be here. My name is Tamsin Holland Brown, and I work as a paediatrician in Cambridge. But I also have been on this innovation journey, which kind of I didn't choose, it kind of chose me, and it's led to many more opportunities as I've grown within my career, which has been amazing. I shall attempt to share my slides and just to explain where I've got to. And yeah, are you able to see that, Rajiv? Oh, lovely, thank you. What I was able to do working as a paediatrician, I had developed a special interest in children who had a hearing loss. And what I was able to see was that the most common type of hearing loss, which is known as glue ear, but medical community tend to call it OME for otitis media with effusion, but it's what we all know. So even as adults, we will have had a terrible cough or a terrible cold, and our ears will have got really blocked up while we were in the middle of that. And you can't hear very well, but it kind of clears after a few days, and then you feel so much better. But it's okay as adults for us to get that condition because we already have learnt our speech and language. We're not learning many new words. Even if we lose 50% of what another person is saying, our brains can pretty much fill in the gaps. And also if we get very blocked up ears after a cough, cold or ear infection, it tends to drain really quickly. And I was watching this happen in children, and it happens to a lot of children. So 80% of children will have this at least once. And when we do hearing screens on children who are starting school and have a hearing screen in many countries, we're able to see that it affects at least 1 in 10 children. So I see this all of the time, and I was starting to worry about this condition because for children, their anatomy is so small that when their ears get blocked, it tends to last much longer, weeks to months. And of course, they're still learning new words, and they're still learning about communication, how to socially communicate, they're developing listening skills about who to listen to, and they're learning how to process auditory information. And so what I was seeing was children who had glue ear, some of them trickling through to my general paediatric clinics with questions like, has this child got a speech and language problem or condition? Has this child got a learning difficulty or disability? Has this child got a social communication problem or even Asperger's autism? Or have they got an attention deficit? So ADHD or attention deficit hyperactivity disorder. So some of these children, I'd be looking back through their medical records and realizing that they had this condition where their ears were blocked and they couldn't hear well for quite a lot of time. And it started worrying me that for some of these children, they were falling behind and not able to catch up. And of course, what we do for children with glue ear is that we wait. And as medical professionals all across the globe know that it's worth waiting to see if it gets better. And so there's a bit of time where clinicians will say, yes, you can't hear very well, your ears are a bit blocked. Let's see how you go for a few months and see if it clears on its own. The problem is that if people do this for a long period of time, that if this adds up to 6 to 12 months of a child's life, it's a big part of their life, and it's at a critical time in their development of speech and language and listening. So what happens in the UK particularly, that's where some of this data was from, is that if children are persistently deaf from this condition, then we do offer an operation called a grommet operation. In America, it's called a tympanostomy tube or T-tube operation, where the surgeon will cut a little, the child will be asleep under anaesthetic. The surgeon will cut a little hole in the eardrum, drain out the fluid, and place a tiny little tube across the eardrum to keep that aerated and let the sound transfer. And those are done. So if we looked up, as our first study was to look at how long does it take a child to get one of these operations. And actually, if everyone's working pretty fast, they're waiting, they're doing repeat hearing tests, the ear, nose and throat surgeon is seeing them, they're put on a grommet operation waiting list, that whole thing takes about 12 months, however fast everybody's working. And so that's a worry, because a year at a critical time in a child's development means that they might be falling behind. Now, you could put hearing aids on these children behind the ear hearing aids that we all know about, but the problem is that the fluid inside the middle ear tends to go up and down depending on whether the child gets another cough or cold. So the hearing aids don't work brilliantly, or they need lots of appointments to have the hearing aids checked that they're at the right hearing level, because it's very easy to get it too loud or too quiet. So one device that works really well that I wanted to think about for my patients was that we used one of these devices, and it's called a bone conduction hearing aid, and it's got a little transducer on the side which takes sound as a vibration and sends it across the bones of the skull directly to the inner hearing, which is the cochlea, and it just misses out the eardrum, which is where that's all glued up with fluid. So it just bypasses the problem area and sends the sound straight to the inner hearing, which is not affected by this condition. And I was desperate to use these in big studies to show that we should be supporting children's hearing in this way. But the problem is that these cost £3,000 each, and whilst they are very good devices, I was told if I did the study, how could the National Health Service provide this for almost 80% of children? How could parents afford this on a regular basis? And actually, if you wait long enough, some of this kind of clears up on its own. So I was discouraged from doing that. And this is what sent me on this journey to try to find something that would be affordable and easy to access and support children's hearing early. And so initially, I actually tried to make my own bone conduction. It wasn't terribly good, but it did sort of work. It had lots of leads around it, which meant that it would have been hopeless for a child because it would have strangled them at some point. So I ended up finding at the same time there were these lovely headsets arriving on the market for cyclists. And the reason that cyclists were using them is that they were popping them on like this, and that they were the headsets were not covering their ear canals, but they were able to have their trainer on their phone, which connected to their headset, and they still had their ears open to be able to hear traffic noises and not get run over. So I looked at the best quality of these headphones and thought possibly we could use these for children with this condition, glue ear, in two ways. The child could either wear the headset and we could pair it to a microphone so that the child could hear the teacher really well over background noise, or the child could hear the parent if the parent was wearing it, or the child could hear the speech and language therapist if they were wearing it. And that child could do well and get some speech and language enrichment. But also, instead of the microphone, the child could wear the headset, and we could simply pair it to a phone, and the phone could have on it an app which would give which could give speech and language therapy, which could give auditory processing skills and listening skills. And we could make sure that children didn't fall behind while they had this condition. And so I started this kind of journey of research initially very quietly on a Sunday, didn't really dare tell anyone because I was concerned that it might not be it might not show good results. But we were really lucky with what the results showed. So the very first research study there was just on the headsets. Do they work? Can children hear with them? And we were able to see that actually, on average, children can hear about 16 decibels better when they're listening to speech. And grommets give about 12 decibels improvement when you do a grommet operation. And in fact, the grommet operation, the little grommet tends to fall out after about somewhere between 6 months and 18 months. And so actually you stop getting benefit from it then. So we were able to show that it's equivalent. The next study I did was I built the app, which had the speech and language therapy that can be uploaded, that has speech and language enrichment activities and listening skill activities. And I just looked at that app with families. Could children use the app? Did they like it? What should we have on it? And in fact, one thing that parents wanted was a hearing screen that they could do at home between appointments. So we added that onto the app, and we tested the app, and we were able to show that the hearing screen was good enough for home use. The third study is actually, we're still waiting to see if it's published, but it was actually looking to see if it would help children with a condition called auditory processing difficulties, which I can come back to later. But the last study I did was last year, and suddenly what we were able to see last year was that in March 2020, as we all know, COVID arrived for us in the UK, and then within a couple of months, grommet operations were taken off. They were unable to be prioritised, and neither were children's hearing services. And so what we were able to do was simply take the headset, the microphone, and details about the app, pop it in an envelope, and see if we could remotely monitor. This is me remotely following up a little guy here whose family have consented to let me use the photograph. And it was a really interesting study because it was the first time that there was nothing available for these children, and we were able to completely support them remotely. And we found out lots of interesting things which are here, which is that these children actually, before the pandemic, end up accessing lots of different health services because they can't hear very well, and so they end up accessing speech and language therapists. They end up seeing pediatricians. They sometimes end up seeing things like occupational therapy services in order to try and cope with sensory loss, but actually their problem is that they can't hear. And so we were able to show that parents can pair up by Bluetooth a headset to either a microphone or an app, and we were able to see that parents found this an acceptable management strategy. And we were very lucky when we did when we surveyed parents that the little blue lines are where the child just had glue ear, and the orange lines is when they were wearing the headset. And it's not rocket science to know that when you have glue ear, the parents describe their hearing as below normal. The child was often mishearing words. The child was often mispronouncing words, had difficulty hearing in a group of people, and had difficulty concentrating. And often their speech was behind. But when we put the headset on, even in the first 3 weeks, whilst wearing the headset, the children were responding. Their hearing was more normal. They weren't mishearing. It was easier to hear within a group. And in a few cases, their speech was starting to improve at that point. And actually, the interesting thing is that some parents as hospital services returned to normal, chose to stick with the headsets rather than have a full operation. And what we learned from that, and you're always learning, is that one thing that we needed to add to the app was a care plan, because we had completely empowered the families and the children to manage their own condition remotely. But what we hadn't done was make sure that the teachers, the parents could communicate what was happening with the teachers. And we realized that this was a huge thing that I hadn't thought about. And so we ended up making a care plan and uploading it quickly onto the app during the pandemic. And the idea is that we can now treat children with glue ear much earlier in the pathway. We can provide them with hearing much earlier so that we can prevent them from falling behind. And it's been exciting in other countries where people don't have access to ear, nose and throat surgeons, or it's expensive to access hearing aids or grommet operations. We've had some lovely collaboration with hospitals abroad, where in, for example, the Global South. And due to this wonderful collaboration with the Raspberry Pi Foundation, the National Deaf Children's Society, professor in charge of global health, that we're able to start thinking about how we can get these headsets to be affordable and to people who need them most. So that the moment with the headset that is just coming out now is together with a microphone, and the app is free. It will cost about £50, which is a whole lot better than the £3,000 that we had initially. I've been incredibly lucky to have won some awards. Of course, it's been a hugely hard journey, actually. And for every 1 page of awards, there's been 10 pages of sitting on the stairs at 2 o'clock in the morning, wondering how we can carry on doing it. But delighted to be contacted by anyone who might be interested, and feel so privileged to have spoken to you all today. Thank you so much. Does that work?
Wow, what a journey, Tamsin. Thank you so much for sharing that. It's phenomenal what you've achieved and the impact you're making. I was wondering if you could tell us a bit more about how others can, take a leaf out of your book and almost continue a journey that so many of us are doing in the Entrepreneur Programme to improve healthcare. Would you mind telling us a bit more about how people can get involved and the opportunities to innovate and improve health through the CEP?
I think the landscape is becoming really rich in this area now, thank goodness. And so I felt like it was difficult, but for every person that's innovating and sort of changing the conversation within their NHS trust, it's quite right that everybody's so busy that they're not doing the preventative work, and that we are doing the firefighting. And it's hard to make that change, but for every person that makes a little bit of a change, it changes the conversation locally about and empowers other people. And it also, I think for some people, and I was guilty of this, I thought it was without seeing other people do it, then you feel like it's hard to do that first step, that maybe people will think that, can you stop doing this? Can you just concentrate on seeing the patients? And I think that there is some empowerment from seeing other people do it, but then you get that additional help from platforms such as the Clinical Entrepreneur Programme, which are trying to keep NHS doctors within the NHS, but allow them time to innovate and give them access to professionals and a teaching program to help them build their innovation and to know what to access next. And I think that those help give validity to people. And of course, that program, which started quite small a few years ago, is now enormously growing and also starting to be adopted in other countries. So the collaboration between other countries has been huge and hugely necessary, because we don't want to keep reinventing the wheel. We don't want people to start trying to do exactly the same thing. We've got to be generous with our innovations, and we've got this wonderful connection with wonderful events such as this, where you can connect people, and we should have much more of this going on. And I do congratulate this platform for doing this.
I think I think the key word, as you say, is collaboration, and I think there's so much opportunity there, isn't there? And that we've received quite a few questions, and I just, if you've got time, ask you the same question that we've asked Sandeep earlier, because like you said, taking that first step, I think as clinicians, I think there's almost a degree of institutionalization, isn't there, in terms of boundaries, what I can or can't do, rocking the boat. What would you say, if someone now in the audience, and what would you recommend, that they should do if they're passionate about doing something different and taking an innovation or an idea forward? What should be their first steps?
There's in a lot of NHS trusts, there's often now just starting to emerge innovation champions. And if you've got one of those in anywhere that you work, that's great, or anyone who has done something similar. And there often is someone who can help you with starting something. And having those conversations is terribly important. And I think also I hadn't involved the management team. And that feels really big to say, because at the time when you're starting, you feel like you've got this idea, but it might not work. And that's part of innovation. You're risking things and you might fail. And so I think that don't worry too much about failing. I worried a lot. I was almost too embarrassed to tell anyone that I'd come up with these headsets, and I chose one or two people very carefully. And one of them was just about to retire, so I thought that if I damaged everything, my reputation and completely, that it wouldn't be maybe the end of the world. And someone else didn't actually work directly with me, so I was that nervous at the beginning that someone might think that it was silly to think about doing it in a very affordable way like this. And I think that looking back, I wish I'd had a little bit more confidence. And I also didn't see myself as a clinical entrepreneur. I saw a poster which talked about for clinical entrepreneurs who would like to learn a little bit more about getting an innovation out there. And I saw and I thought, oh, I wish I was a clinical entrepreneur, because all of that looks like I could really do with learning about it. And I think that I just hadn't seen myself in it. And I think that's why we have to see representation across the board, from women, from mothers, from everyone, and multicultural too. So I think that it's just important that you can see yourself represented as a clinical entrepreneur. And I hope that the global clinical entrepreneur in the UK is beginning to do that. Thank you for allowing me to speak, and I would be delighted to connect with anyone who would be interested to make sure that about either clinical entrepreneur work, or if anyone's interested in the work that I'm doing, then delighted to speak further. And thank you again.